Uterine inversion is a complication when the uterus turns inside out after the delivery of the fetus. 4 degrees of inversion have been described. In a first-degree uterine inversion, the uterine fundus inverts into the endometrial cavity, and a dent in the uterus may be felt during abdominal palpation. In a second-degree uterine inversion, the uterine fundus passes through the cervix. In a third-degree uterine inversion, the uterine fundus reaches but does not bulge past the introitus. In a fourth-degree uterine inversion, the uterine fundus bulges past the introitus. The uterus is completely inverted. It is seen bulging out of the vagina, which is also inverted in this degree of inversion. During abdominal examination, a dent may be palpable in the uterine fundus, or the uterine fundus may be felt lower than expected. Upon vaginal examination, the uterus may be visible or palpable in the vagina or at the perineum. To reposition the inverted uterus, immediate action is required, since inversion of the uterus is a life-threatening obstetric emergency. If not treated immediately, it can lead to severe hemorrhage and shock. Moreover, repositioning gets more difficult as time passes due to edema formation in the inverted part of the uterus. Help should be called for immediately. Hazard: removal of the placenta. Take note that the placenta may still be attached to the uterus. In this case, the repositioning of the uterus should be prioritized over the removal of the placenta. Hence, the uterus should be repositioned prior to removing the placenta. Take note that during the repositioning of the uterus, it is advised to stop the infusion of any uterotonic drugs. Atonic drugs may be administered to further relax the uterus. The Johnson's maneuver is the first maneuver that should be attempted in the event of an inverted uterus. The dominant hand is lubricated and inserted into the vagina with the 5 fingers brought together to minimize the hand circumference. After inserting the hand, it is then clenched into a fist to prevent injuring the uterus. Pressure is then applied to push the fundus back past the cervix, back into its natural position. Simultaneously, the non-dominant hand exerts external pressure. This is done throughout the whole procedure. The fist is kept in place until the uterus is sufficiently contracted. This is done to decrease the risk of it inverting again. It is advised to administer uterotonic drugs for this purpose. The O'Sullivan maneuver may be performed if the Johnson's maneuver was unsuccessful. During the O'Sullivan maneuver, the uterus is repositioned using hydrostatic pressure, pushing the fundus in upward direction back into its natural position. It is very important to note that hydrostatic pressure should only be used if uterine rupture has been excluded. First, the umbilical cord is put inside the vagina if the placenta has not been delivered yet. Subsequently, the open end of the tubing of the giving set is placed in the vagina. Simultaneously, the introitus is closed off with a silicone cup or oxygen mask. Then the vagina is filled with 2 to 3 liters of warm saline solution. Take note that in order to create sufficient pressure, the bag of fluids should be elevated about 1 to 1.5 meters above the level of the vagina. An inadequate pressure gradient or incomplete sealing of the introitus may lead to failure of this procedure. Alternatively, the vagina may be sealed by enclosing the labia majora around the wrist of the dominant hand, or by placing a hand over the introitus. After repositioning the uterus, it is advised to administer a uterotonic drug to decrease the risk of the uterus inverting again. If the O'Sullivan method is unsuccessful, the uterus needs to be repositioned in theatre using the Huntington's or Halton's technique. Take note that before performing an operation, the Johnson's maneuver may be attempted once more, but under general anesthesia. After the repositioning of the uterus, the placenta is manually removed if it is still present. For a more detailed elaboration on this, refer to the course Manual Removal of the Placenta.